I am profoundly disappointed that confidential internal conversations have been shared, actions that are a violation of the public service oath and code of conduct. This is a personal betrayal and a betrayal of the trust that our hardworking team has placed in each other. For months, I have worked alongside a team that has been dedicated to supporting Albertans in responding to COVID-19. The team has been committed to providing evidence to inform policy decisions. They have spent time away from their families to do this work and provide their best advice. They have given their all, and they continue to do so. I am profoundly grateful for the commitment of this team, and today I have reminded them of my gratitude and commitment to their work. Almost every day of the week, we discuss how to improve the pandemic response and to debate a variety of ideas about how we can do better. The comments, as reported, are taken out of context, separated from the many other discussions that would have occurred in the days before and after, as part of ongoing discussions to ensure that my advice to the Premier and to the Minister of Health is grounded in evidence and considers every facet of potential discussions with elected leaders. This process has been violated. I have always felt that my ideas are respectfully considered. I have always had respectful discussions between public servants and with elected officials. I do not dictate every detail of each policy decision, and I should not. I was not elected by Albertans. The final decisions are up to elected officials who were chosen by Albertans. This is how democracy works. I know that there are many views about how we should proceed. However, we are becoming divided when we most need to engage in respectful dialogue. We need to do this together for the health of all Albertans. We must listen to and consider the thoughts of others who do not agree with us. All of us want the same thing: to protect the health of Albertans, to protect our health system, and to minimize the impact this pandemic is having on everyone's lives. My professional integrity is incredibly important to me, and when I have taken an oath that indicates that I will provide the recommendations to elected officials in confidence, it would be inappropriate for me and a violation of my professional integrity to break that. I believe that Albertans understand that I provide those recommendations in their best interest. And again, it is the individuals that Albertans have elected, trusting them with the responsibility of making those weighty decisions on their behalf. And so Albertans have placed their trust in those officials to take my recommendations along with all other considerations and to make the best decisions possible. I do not know who made the recordings and who spoke to CBC. There will be an investigation to determine who has done this because, as I said, this has serious repercussions and is a violation of the oath that all of us have taken.
What I see as attacks on the credibility and the independence of the office of Dr. Hinshaw and herself and the ministry end up, to some extent, undermining as well the confidence that people have in the measures that we've announced, including the ones this week. The difficulty with that is that results in people not giving credence or deference to those measures, and which means there's an opportunity for people to continue to spread the virus throughout our community. So it is, unfortunately, incredibly irresponsible to see these types of attacks on this credibility and the independence of Dr. Hinshaw and her office. And I hope that those who are perpetuating it realize what's going to end up resulting with these types of stories, and that this ends.